The older you get, the more reason there seems to be taking something or another in the way of a pain medication. Often it's NSAIDs. There's been concern in the past about the use of these particular over-the-counter agents and what their effect is on the cardiovascular system. I am with one of my favorite columnists from CardioSource WorldNews. And Dr. Kohli, I got to say, first off, thank you very much for the work you do for us, the column. It is so much fun for the fellows that read you, and I certainly do. Thank you. We're talking about a trial, and it's part of the TIMI study group, correct? And NSAIDs. What did you do and why did you do it?
Okay, well, you alluded to a very important point, Rick, which is that NSAIDs are over-the-counter medications, and for that reason, people tend to think that they're very safe and absolutely okay to take.
Like vitamins.
Exactly. And especially the older patients, which are the ones that are probably at the most increased risk. So the reason we thought we'd look at the use of NSAIDs in a large registry of patients, so we're looking at over 40,000 patients that have stable atherosclerotic disease, and looking at over 4 years to try to see how NSAID use correlates to their outcomes. And we're talking about very hard outcomes here: cardiovascular death, MI, stroke, heart failure, and ischemic hospitalization, such as losing an arm or having a CABG or having a PCI. So I think a very important question and very clinically relevant, because we do have some suggestion that NSAID use is associated with worse outcomes, but none of it has really actually reached statistical significance. So it's still up in the air whether it really is safe or not to take these medications. So we took 44,000 patients from the REACH Registry, followed them for 4 years, and looked at the baseline NSAID use to try to see if it was associated with worse outcomes.
And what did you find?
Very interesting data, actually. We found that it was associated with worse outcomes, particularly heart failure. And the mechanisms that have been proposed for that is that NSAIDs cause salt and water retention, which can worsen heart failure. It was also associated with more ischemic outcomes, which means that more people were losing arms, more people were getting admitted with strokes, more people were getting admitted with ischemic events. And the reason we think for that is potentially some sort of an antiplatelet interaction that may interfere with aspirin's antiplatelet interaction.
Now that we have this knowledge, what do we do with it?
Well, I think it does make us more cautious about using NSAIDs, and particularly for primary care physicians, which I think this is a very important message for, because they're given to patients without a lot of consideration to the long-term effects. So I don't think we can completely eliminate that class of drugs, because it does have some valuable effects in certain populations, but I do think we're going to be a lot more careful about using them.
And did you enjoy doing this particular trial? I mean, this is one that it has such an important impact on a variety of different things. Was it fun?
Well, for me, actually, it was so much fun, and it hit home on so many levels, because my previous background has been in looking at cyclooxygenase inhibitors in animal models and studying the very molecular basis of how cyclooxygenase works and how it inhibits many of the downstream effects that it has. So this was a very nice clinical correlation to it, and I know that I'm going to be careful about using NSAIDs in my patients from now on.
Very good. Yeah. And please read Payal's FIT column, because it's in every issue of CSWN. And for ESC 2012, I'm Rick McGuire, the executive editor of CardioSource WorldNews.